Hey, did you know that disc herniations are the most common low back injury for young and middle-aged adults, and ever wondered how they happen and why they keep on coming back? Hi, my name is Dr. Becca, and today we're going to discover the surprising causes behind this nagging pain and what you can do to break the cycle for good. To understand disc herniations fully, we need to understand the intervertebral disc anatomy, and we're going to go through this simply so you can repeat it to a friend. Now, there are two parts to a disc: the outer rim called the annulus fibrosus, which is made up of a very thick cartilage, and the inner part, which is like a liquid jelly substance called the nucleus propulsus. Since the outer rim is made up of this thick cartilage, it can undergo micro or macro tears due to a traumatic event with a high load, or gradually over time with low loading. So some examples of a traumatic tearing event can be lifting heavy objects with poor spine mechanics, bending over with a twist, having an unstable spine when lifting, crouching and then you happen to sneeze or cough, and of course through particular sports such as football, hockey, or gymnastics. Basically, if the force is great enough, the liquid substance could move past this cartilage rim to cause a bulge, and there are a lot of different levels of bulging severity. But how does this explain pain and possibly re-injury? We have to look closer at two ligaments in the spine, the anterior and posterior longitudinal ligaments, which their anatomy can give us a better understanding of how disc herniations are occurring. You can see that the posterior ligament is a lot more narrow than the anterior ligament, and because of this, the disc has the ability to squeeze past that posterior ligament to either side. This is why pain can develop on one side but sometimes switch to the other. Now, if the disc is pushed back far enough, this creates less space or increased compression between the disc and the spinal canal, where a lot of different nerves and your spinal root nerves exist. All of this can basically be explained in a simplified jelly and cookie analogy. So if we complete the right exercises, most likely extension is the direction of preference, we can help to preserve that disc more anteriorly versus posteriorly away from sensitive nerve structures. Unfortunately, most people are not aware of how to properly preserve the disc with correct movement or loading, so the occurrence of re-injury is typically high. Now, the goal of rehab is to try and preserve the disc and let the torn cartilage parts heal. Disc herniation recovery can be done through proper spine mechanics, specific and functional exercise, and of course, patience. So there is a major 2023 study that has shown that there is no difference in recovery at post 2 years injury between a disc herniation surgery and conservative management through rehab. So check out my next video if you're not sure if you have a disc herniation, or the description below for my best specific exercises for disc herniations. Thank you so much for watching, and see you next time.